reduce the risk of another stroke. Doctor, welcome to the program.
Yes. The phone lines will be open shortly for you to ask your questions because we have a doctor here. But before then, again, this is Women Radio 91.7 FM. This is Radio Doctor, Nigeria's first specialized program where we bring real doctors to consult for free for you on live on air. I'm here, Demi is here, and then we're just gonna get right into the thick of things. Demi, over to you.
Once again, doctor, welcome to the program.
Thank you very much. Thank you for having me.
All right, so doctor, let's start with the basic. What exactly is stroke?
So stroke, also sometimes called a brain attack, is that condition. It's a neurologic deficit that happens because blood supply to a part of the brain has been compromised. That's the way. So generally, there are two types of stroke. In the first type of stroke, the problem is that you're not getting enough oxygen to a particular part of the brain. That can happen because maybe there is a clog in the blood vessels. All right, and when you don't get oxygen, what happens? We begin to experience some form of cell death. Okay, and you begin to now see that in the different aspects of the body that part of the brain controls. The second type is also that type of stroke. We call it an ischemic stroke. All right, it's poor blood supply to that part of the brain. But the other type is a hemorrhagic stroke, which is actually more because there is bleeding of blood vessels to a particular part of the brain, which now also gives you symptoms in the part of the body that portion of the brain controls. I know you've talked about it briefly now. You've talked about the fact that people sometimes will discover that they cannot move a part of their body, maybe an arm or the leg. Maybe you notice that a person cannot express himself or herself, cannot be able to speak clearly if the speech area is affected. But so basically, I would say again that stroke is a neurologic deficit that comes from when there is compromised blood supply to a part of the brain. Thank you.
All right, thank you, doctor. So I know you just highlighted the ischemic stroke and the hemorrhagic stroke. So are we saying the difference is in one it's oxygen and the other is blood? Is that
basically, yes. So in ischemic stroke, right, you're not getting enough blood. That is the problem. I mean, blood carries
oxygen?
Oh, Dr. Sadewell, I think his network has frozen for
oxygen.
a bit.
Come again?
Welcome back. You're welcome back. We weren't hearing you. Your network was frozen for a bit.
Oh, okay. All right. I might have to switch network if that continues. Okay. So, what? Can you hear me?
Yes, we can hear you.
Okay. Yes. All right. But again, when you have a bleeding, that could also compromise blood supply to that part of the brain because it's not in the usual vessels, the usual way that blood is supposed to be carried. But the other thing is that it now creates a pressure effect on that part of the brain when you have bleeding within an enclosed space. It creates pressure on that part of the brain, causing many of the manifestations that you might see. Thank you.
Thank you, doctor. All right, doctor. So sometimes we hear doctors say time is brain. What exactly does that mean?
Oh yeah. So yeah, thank you so much. So for strokes, it is extremely getting treatment on time
Mm,
determines a lot about the outcome of that stroke. Now, remember that what we're saying, the commonest stroke really is the ischemic stroke, where there is poor blood supply to where there's poor blood supply to a part of the brain. Now, one of the ways that the body works or the cells work is that when you're not getting oxygen in a part of the brain, you begin to have some level of death. Let's just some death of some of those cells.
mm,
If you can intervene on time, the greater the chances of recovery, right? Before you now, otherwise, after a time, you're going to have more of permanent damage to that part of the brain, and of course to the part of the bodies which it does which it supplies. So yes, time is definitely of the essence, and usually you want to see you can get everything done within the first hour that a person is presenting. There are a few other timelines, but I would just say that within the first hour, you want to see how you can quickly identify what sort of stroke are we dealing with. You want to be sure that, okay, is this person bleeding, or is this person having compromised blood supply? Now, why that is very important is if someone is bleeding in their brain, you don't, okay, let me start from the other way. I think it will be easier to appreciate it that way. If there is a clot that is preventing blood supply to a part of the brain, part of the treatment you would want to do are things to help you to dissolve a clot so that you can get blood supply to that part of the brain. Now, think about in the reverse. If the person is already bleeding and you are providing treatment that actually dissolves blood clots, you're actually worsening that type of stroke. So it becomes extremely important to determine, is this from a bleed? Is this from a clot? Because it's almost as though the treatments are in opposite direction, and you want to be sure that your treatment is not worsening the outcome or the recovery of someone. Yeah, thank you.
mm. Thank you very much, Doctor, for that. How common is stroke in Nigeria today?
Well, stroke is extremely common. It is the leading cause of disability in the world, and also with us in Nigeria. It's one of the commonest complications that we see from hypertension and sometimes from diabetes. It's one of the commonest complications that we see, and you see it quite often, almost like a 1 in 10 of people with this risk factor. So I would say stroke is quite common, and it's quite commoner than we used to think here.
Mm. Thank you, Doctor. So I know we attribute stroke mainly to the older people. Are younger people also at risk of stroke?
Yeah, so all right, so maybe this will be a good time to talk about risk factors for stroke, and so maybe that would help. So generally we talk about the modifiable risk factors and the non-modifiable risk factors. So non-modifiable risk factors are generally things that there's nothing you can do about them, right? For example, if you are a male, you are at higher risk. If you are Black, you are at a higher risk. Then as you keep growing older, there's nothing you can do about advancing in age. The risk is also increased. So those are generally non-modifiable factors. But then there are modifiable factors, which are one of the major areas we like to settle in in order to be able to prevent things like hypertension, high blood pressure, diabetes, high blood sugars, high cholesterol, obesity, sedentary lifestyle, right? Not getting enough physical activity. There are a few other things that we may consider, which may not be as common as some of these things. When somebody has an abnormal clotting disorder, right, where they I lost you, or you lost me?
No, we can hear
We
you.
can hear you.
Oh, okay, all right, okay, yeah, where somebody's blood clots a bit more than it should, right? So there are some clotting disorders like that. Sometimes people on things like combined oral contraceptives, some of those things can also predispose. But by far the commonest are actually many of these modifiable risk factors: hypertension, diabetes, high cholesterol, sedentary lifestyle. So is it a disease of the older people? Not necessarily. Yes, as you increase in age, your risks increases. But you know that, again, now we know that it's not only in middle age that people develop hypertension now. It's not only in middle age that people develop diabetes now. Okay, the numbers are coming down, and the risk and so the complications are also increasing even in younger age. We have seen in my practice, we've seen people under 40 have stroke. We've seen people in their 40s have stroke. So so I think right now emphasis should be more on modifying the modifiable risk factors. Now, there are a few other things that may not be as common. Maybe somebody has a structural abnormality of the blood vessels in their brain, aneurysms that can easily burst and all of that. So those are also options. But again, when you look at the numbers, common things they say occur commonly. And the commoner risk factors are, I would leave it at those that I've mentioned: uncontrolled hypertension, uncontrolled diabetes, uncontrolled cholesterol levels, sedentary lifestyle, and obesity. Thank you.
Thank you so much for that, Doctor. I like that you talked about the risk factors, but if we're just going to jump straight, like, what are the warning signs that everybody should know? Once, like, I think when stroke is about to happen, yeah.
Okay, yeah. Okay, so thank you again for that question. Again, in answering this question, we cannot overemphasize those risk factors, in the sense that those numbers need to be under control, right? Your blood sugars need to be, because for me, if you have uncontrolled blood sugar, uncontrolled blood pressures, that's a warning sign for me that you are at risk of having a stroke. I'm just saying a bit more on the preventive aspect. But when people are likely to have strokes, so sometimes people have suffered what you call a mini stroke before, something that we call a transient ischemic attack, where they just, for a short moment, less than 24 hours, maybe there was some facial deviation, weakness of some part of the body, they couldn't sleep, they just woke up and discovered this was the situation, but then it cleared after some time. Now, you know, at the risk of sounding sarcastic, but it's to say that I know many people will throw a party that, yes, thank God I recovered from this, and yes, thank God But that is a big warning sign that you are likely to have a major stroke. Okay. So that because there are risk factors, that have led you to that point. In a few people, sometimes they could have this kind of blackout where they're just unable to see for some time. That could also be a warning sign. That could also be a warning sign of the likelihood of developing a stroke. So if you've had a mini stroke before, you are to be on lifetime prevention.
Okay.
Lifetime prevention. That cannot be overemphasized. Secondly, okay, so what are the signs that you would see when you do develop a stroke? So usually we talk about the fact that sometimes the face may be a little bit deviated to one side or the other. There may be weakness of the arms, all right, or maybe of the legs, or right, and there may be slurred speech. So there is the mnemonic FAST, FAST. So we talk about facial deviation, arm weakness, slurred speech. So think about those, but the T there comes back to the first part of the discussion, time, and that immediately any of those takes place, you must seek medical help immediately, because the golden period is within the early hours of that stroke. That is the time that interventions are best. That is the time that you have a higher rate of recovery. Having said that, so those are some of the signs that people can present with. But having said that, sometimes people have also had a stroke before and they're happy that they have recovered. One of the things we like to reemphasize to people is that, like they say, stroke begets stroke. All right. So if you have had a stroke before, again, it tells us that you have all the risk factors to be able to develop another stroke. And so you need to be on lifetime prevention. And the lifetime prevention would include regulating all the risk factors, your blood pressures, your blood sugars, and there are likely medications that your doctors will put you on for a lifetime, some to help with clot prevention and also cholesterol control. Regardless of what your cholesterol number are, we call this secondary prevention. So that's important. Now, why do I think it's important to say this? Because many times you see stroke patients and you're trying to follow up with them to know, okay, so how are you doing for stroke care? Physical therapy is very important, right, in helping to rehabilitate. But many times people now, the only care they are receiving is physical therapy. Unfortunately, you're putting yourself at the risk of another stroke because you're not addressing the underlying risk factors that predisposed you to that stroke. So all of this, so both medical care and physical therapy have to go hand in hand. Thank you.
Wow, that was exhaustive. I watched a video of a mom who was talking about her 6-year-old or 8-year-old who had I think 4 strokes already. In fact, there was a video she was showing that there was a video she put up and said she didn't even know her son was having a stroke until she started noticing. She noticed that he was walking to one side, he was bent one way. She also noticed that he was staggering, but she just shrugged it off until they called her from her son's school and said, your child has had a stroke. So that's just to say that it does. Back in the day, we used to think that maybe it was only adults, old people that had stroke, but obviously now we're seeing that anybody from whatever age it is the person is they can have a stroke. Thank you so much. Over to you, Dami. Demi.
Yeah,
All right,
but
doctor.
if I make comments about that, again, in that age group, again, it's quite unlikely that
Yeah.
that it is some of the risk factors we're talking about here.
Yeah.
Those may
Okay.
be some of the rare exceptions where there may be a structural abnormality that needs
Okay.
to be discovered
Right.
and to be dealt with. So just to
Thank you
share my
very much.
yes.
Okay.
All right, doctor. Um, so if someone suddenly develops symptoms of stroke, as somebody that is around them, what are the first things that they should do? Are there things they should not and things they should?
All right. Thank you very much. So if somebody develops symptoms of stroke, one of the first things not to do is not to panic. This is not to say that we should not be concerned, but unfortunately, when we panic, things become a little bit quite disorganized. Okay, so you want not to panic. Support the person and see how can you get the person to the nearest hospital. Okay, because it's important to evaluate the person. It's important to evaluate the person on time. Make a proper diagnosis. Look at what are there predisposing factors. Is this person at risk? Please don't try to feed the person at that time, because you
Right.
also you don't know whether the stroke affects their swallowing reflex, and you don't want them to you don't want to go and aspirate. So I would say get the person to a nearest hospital, hopefully a hospital that you have a good knowledge of their workings, and ability to handle medical cases. There are a few stroke centers in the country, but probably not as widespread as we would need to get to everybody. But please get the person to a hospital, allow a doctor to be able to assess, and most likely better if it is a hospital where a CT scan can be done immediately. But if not, one that would at least have an arrangement to get a CT scan done as fast as possible, because it helps us to differentiate. It helps us to differentiate the type of stroke. It's important to say that sometimes, yes, when people have a stroke, you may find increased blood pressure, or that maybe blood pressure has been increased in the background. Please do not be overzealous to try to bring down that blood pressure. Allow that to be handled by the medical practitioner, because again, what happens when there's been high blood pressure over time is that even the brain has had a form of what we call auto-regulation, got a bit used to that. And if you're going to bring down that blood pressure, it's going to be brought down gradually. And there are drugs that are safe. And in fact, under some circumstances, the rule is do not even touch the blood pressure in the first 72 hours of stroke. There are a numbers that your doctors will look at and say, okay, it's gotten to this point. We're looking at the mean arterial pressure. Maybe there is a need for us to do some cautious regulation, but it's not being over aggressive with the control of blood pressure can be more detrimental than good. There is a practice, I must say, well, again, this is not usually done merely in stroke, but in severe hypertension, that used to be in place. which we call the use of sublingual nifedipine. That means that the person's blood pressure is high, we take nifedipine, put under the tongue. That practice has been stopped, okay, and so banned because the risks and the complications are also quite high. So I would strongly advise against it. And if you're at a hospital where that is being done, then you may want to also seek care other way, because the complications are also quite grave because of it can cause a precipitous drop in blood pressure. Thank you.
Thank you, doctor. So is there, I know we've spoken about the things to do when it first happens. Is there a treatment that can actually reverse the stroke if the patient gets to the hospital on time, or they just manage it and live with it?
Okay, yeah, so thank you so much. Again, that's where I say that the identification of the type of stroke is paramount. In the bleeding stroke, the hemorrhagic stroke, many times the goal, it would be, one, to bring down the blood pressure. This is one place where they would actually want to bring down the blood pressure, but there is also a chart for bringing that down. If you notice that there is increased pressure on the brain, there are medications they will give to decompress the brain to reduce the pressure. And depending on the extent of the bleeding, and the extent of the neurologic deficit, there may be a need to do what they call a borehole surgery, where they could open a part of the skull to get the blood out and relieve the effects. So that's for and again, people with hemorrhagic stroke, sometimes they may have seizures, so they might also put them on medications to control seizures. So that's one. But for ischemic stroke, again, I would like to reemphasize that, which is far more common. You're thinking about the possibility of a clot. So there are treatments also for that, and some of those treatments are best within the first 24 hours. Sometimes your doctors could use high-dose aspirin, and then also depending on if the person meets the criteria for what we call thrombolysis, that is clot dissolution. There are medications that can be given to dissolve the clot. There are also in centers with advanced techniques, there's also things they call endovascular techniques, whereby you're able to trace the blood vessels through the blood. You're able to trace the blood vessels to the brain to be able to remove the clot. So I think there are several options that can be done depending on where you are, depending on the type of the stroke, and depending and of course I think on your clinician's judgment of what is best at that time. Okay.
Thank you, doctor. All right, doctor, there are many people that have high blood pressure or diabetes and don't realize they are at the risk of stroke. How can telemedicine help them in such situations as well?
How can what help them?
Telemedicine.
Okay, all right. Thank you so much. I think again, like someone said, COVID brought to us lots of possibilities, and I think telemedicine is one of those possibilities that it brought to us. So I understand that our health-seeking behavior as a country is not so great. For some people, they cannot afford it, but for some people, it's just not a priority. Okay, and for some people, I'm too busy and all of that. So I think telemedicine can be helpful in the sense that if you are able to have consultations with your doctor, you are able to discuss your numbers, okay? Because one of the biggest messages I like to give to people, especially in prevention of many of these cardiovascular diseases, stroke, heart attacks, and more, is know your numbers, right? Know your blood pressure numbers, know your blood glucose numbers, know your cholesterol numbers, and possibly know the number of your steps, the number of steps you take in a day. Your doctor is able to review with you what exactly your numbers are, what does that mean to you, and what steps do you need to take to be able to prevent some of the feared complications. So I think it also probably makes healthcare accessible, especially to those who may not want to visit the hospital. Of course, there are times that there is no way you have to be seen physically, but it can serve as a stopgap in between. Yeah.
Thank you, Doctor.
Mm.
You're still listening to Radio Doctor on Women Radio WFM 91.7, powered by Teledoc. With Teledoc, you can book consultation at your preferred time. You can join a secure video consultation, upload medical records, and you can receive prescription digitally.
Welcome back to Women Radio 91.7 FM. The phone lines are now open: 07000 917 917, 0800 123 5917, or 9155 917 917. You're going to text us 0703 175 6537 or 08155 917 917. We've been discussing stroke with our Dr. Adewale this morning. So if you have questions on stroke, high blood pressure, rehabilitation, caring for a stroke survivor, you want to call in to speak with our guest doctor. Speaking on rehabilitation, you mentioned, I'm not sure that you did, physiotherapy, speech therapy, occupational therapy. How does that work when it comes to recovery for stroke patients?
All right. Thank you so much. Yeah. So starting physical therapy is definitely one of the things that can help in early recovery, right? So a person has lost what we call muscle power, muscle tone. We're able to help with strengthening exercises, help with the brain and limb coordination. And I think our physiotherapists do quite a good job in helping people to rehabilitate and get back on their feet again. I must emphasize that this must not be done in isolation from medical care, because you don't want to have another stroke while you are recovering from one stroke. Okay, so that's quite important. Yes, again, if the speech area is affected, yes, people should, we could also involve speech therapists in helping people to recover some of these functions, and we've seen people who have recovered pretty well. Now, one part that we probably did not mention also is now the mental health, right? The mental health or psychotherapy. Now, because when people have a stroke, it's a life-changing event, right? Especially depending on the degree of disability that they have. One of the things that is common is what we call a post-stroke depression. And sometimes we may also need to get mental health experts to be able to work with people in recovering. Yes, depending on the degree of disability, we may have to look at things like occupational therapy as well. Now, for people who are quite debilitated, having problems moving, then we have to possibly sometimes even think about home nursing care, because for example, if somebody is unable to move, you're on bed most of the time, then you know that there are risks of having things like bed sores, which can now become a bigger problem. people might be incontinent with their urine, in the sense that they're unable to control their urine. So those are all possible complications that can take place, like I said, depending on the degree of disability that the person suffers. But definitely rehabilitation is an important part of the management of stroke. Thank you.
Okay, thank you so much for that. So for family members, how can they support, someone recovering from stroke without making them feel helpless? What's the support, emotional support and all of that for them?
Thank you so much. Yeah. So I think one thing to is number one, to accept that this has already happened, right? So right now the question is not about what you should have done or what you didn't do. The question is, it has happened. So how do we take it up from here? And I think part of the support will be to ensure that the person gets proper medical care. Gets proper medical care, number one, as soon as possible. All right, because that helps in determining your recovery. Okay, so getting proper medical care as soon as possible.
Right.
Now ensuring that follow-up is also regular.
Okay.
It's very common, again, we see stroke patients, they've come back once or twice and then they just ditch their follow-up. The concern is the possibility of having a repeat stroke. And sometimes one of the things that is common with us in this part of the country is that we think that because your doctor prescribed a medication for you 6 years ago, that is still the same medication you're taking.
Yeah.
But there is a reason why you should have frequent follow-up, and that will be spaced. So ensuring that there is regular follow-up, of course, helping people with getting into physical therapy, as the case may be. So these are some of the areas that we can come in. When people have limitations in carrying out their activities of daily living, probably getting them like a support, someone who can help them, that would go a long way. And I think just, the gift of presence,
Right.
the gift of presence, right? Just being there. Remember, just sometimes we need to just put ourselves in people's shoes and just ask that, if this were me, what exactly would I want? It's a life-changing, it's a life-changing event, and we need to show that empathy. If you discover that the person is becoming too withdrawn, is refusing to eat, maybe is sleeping too much or not sleeping, no longer showing interest in usual activities, please do not hesitate to also get mental health support for the person. And there's absolutely nothing wrong there's absolutely nothing wrong in getting mental health support. If you can get support for physical disease, there is no reason we shouldn't get support for emotional health. Thank you.
All right, doctor. Thank you very much for that. I have two questions before we wrap up. Can atrial fibrillation or any other heart condition increase the risk of stroke?
Absolutely. Yes, so absolutely. So atrial fibrillation, just maybe to just put it in a very mild terms, is the heart, just say the heart is firing. And of course, when you have atrial fibrillation.
Oh, we have a call. So sorry to interrupt you. Hello, good morning.
Hi, good morning.
Good morning. Is that Mrs. Aboli?
Hello?
Hello, good morning. We can hear you. Go ahead, Mrs. Aboli.
The first question, plastic treatment, stroke related cases. That's my first question. The first thing, the stroke patient should follow. You can prescribe this medicine. Lastly, the third one, prevention they say is better than cure. Prevention, our economy, and the mental state of the average Nigerian. So you need fully that presently we can't even boast of that because it's a far cry from our present reality. What can you say wholesomely to the potential stroke survivor going through patch presently? Good question, sir.
Thank you so much. Were you able to get the questions, Dr. Adewale?
No, if you can re-echo them.
I wasn't hearing either. I'm asking in the studio. I'm not sure they could hear either. Mrs. Oboli, please, can you send it as WhatsApp messages, please? Because we couldn't get those questions.
Should I repeat it?
Yes, please. You can repeat it. Yes.
All right. I said, is this plastic treatment? Like, I want somebody that, she has been going and
I think that the line is seasoned. We actually cannot hear you, Mrs. Oboli.
send it. I'll send the message. Don't
Thank you. Thank you so much. Thank you so much, Mrs. Oboli. This is still Women Radio 91.7 FM. We're going to buy Mrs. Oboli some few minutes so that she can send in the questions and then Dr. Adewale can answer. I think Demi had asked you a question, Dr. Adewale, about
absolutely.
April something.
Yes, fibrillation.
Yes. So if when the heart firing is not well synchronized, that in atrial fibrillation, so it gives an increased risk of dislodging a clot, of sending a clot to the brain, causing a stroke. So for many patients who have atrial fibrillation, for example, part of the things that we do is to put them on oral anticoagulants in order to, and the whole goal of that is to prevent a stroke. So yes, atrial fibrillation and a few other heart conditions can predispose to stroke, and maybe that's that also helps me to remember that when people have strokes, one of the things we want to do is we want to check their heart to be sure that there are no any risk factors, clots and all that, and also to check the carotid arteries to be sure that is there a narrowing of the carotid arteries taking blood to the brain. So that's also part of the evaluation that is done at times when people have ischemic strokes.
Okay. The questions from Mrs. Oboli. Number one, is there a place for naturopathic treatment in stroke-related cases? Number two, for fast healing, should there be a strict regimen diet they should follow or a rudimentary lifestyle you can prescribe? Lastly, prevention, they say, is better than cure. Knowing fully well the state of the nation, our economy and mental state of the average Nigerian, knowing fully well that balanced diet is a far cry from our present reality, what can you say wholesomely to someone listening to you now, a potential stroke survivor going through a rough patch?
Okay, thank you so much. If I missed any, please just bring me back. I'd like to start with the third question with regards to prevention. Prevention is always better than care, and I try to really emphasize that, and that's something I am particularly big on. So when we talk about prevention, there are levels of prevention. Let me say that. Okay, for example, and maybe to simplify it, I'll talk about 3 levels. There is primary prevention, in which a disease has not happened, and you want to ensure that you prevent it from happening. Okay. Secondary prevention, a disease has occurred, but you want to treat it early to prevent its complications. And thirdly, and in tertiary prevention, we're talking a bit more about rehabilitation. Now, okay, so now let's therefore now look at that question. So are there things we can do in preventing? So we've talked about the risk factors. We've talked about things like the sedentary lifestyle. That is, so what is the prevention? People should become active. You can aim for having about 30 minutes brisk walk every day. High blood pressure, we talked about high blood pressure. Now, there are lifestyle changes to managing high blood pressure, which includes things like reducing the amount of sodium consumption, increasing our fruit and vegetable intake. And fruits and vegetables do not need to be expensive. You know, people say, oh, okay, yeah, well, an apple costs this much. How much does a garden egg cost? Okay, or how do you understand? Or how much do some of our green leafy vegetables that you can get around cost? So again, it is a question of placing importance on it and making it a part of our lifestyle.
Okay.
Stress management, getting adequate sleep, you know, and remember again when I talked about exercise, I have not even talked about going to the gym. I'm just saying do a brisk walk for 30 minutes. So these are some things that can help you with regulating things like high blood pressure, regulating high blood sugars. However, in as much as I am an advocate of lifestyle practices, I need to sound this warning that it will be almost suicidal for someone to come in with a blood pressure of 220 over 140, and I send the person home to go and manage it with their lifestyle. Lifestyle modification is almost always the first part of management of any chronic disease. However, there are times that you would have to combine this modification with medical care.
Okay.
Otherwise, in the process of modification, the person is going to suffer a complication, and that's going to I emphasize this to people, and as much and I have spoken severally about things you can do to regulate your blood pressure naturally, but there are times you're going to need to take medications because you at that point taking that medication in itself is a prevention. It's a prevention of complications like stroke, like heart attacks, like kidney diseases, and more. So that would be my response to prevention. The role of naturopathy, I may not be able to speak too much on naturopathy. It's not something I am trained in. I do have some training and experience in lifestyle medicine that I can speak on, and that I can speak on, and there are things that have been well proven in terms of our diet, our exercise, stress management, sleep, avoidance of harmful substances, and social connectedness that have shown to have positive effects on almost every chronic disease that you can think of. I think I missed the second question.
Unfortunately, we don't even have. We've run out of time. She was asking about the strict regimen diet they should follow, or lifestyle, rudimentary lifestyle you can prescribe. I think you sort of touched on that already.
Okay, all right, that's fine. That's
fine. All right, thank you so much.
And let me just say with that is that eat as close to nature as possible. I think that would be my simple answer.
That works. Yes. Okay. Thank you so much, Dr. Adewale, for coming on the program today, for being a part of Radio Doctor today, speaking to us about stroke. If you'd like to speak with him, you want to download the TeleDoc app today to book a 10-minute or a 30-minute for consultation. With that being said, thank you so much once again for the call and for every single person who has listened to us today. It's bye for now from me. My name is Fumi Bangala.
My name is Dimnadi Kawali.
All right. Enjoy the rest of your day.
All right. Thank you very much. Thank you for having me. Yeah.